Currently, there is no vaccine to prevent the coronavirus disease, but you can protect yourself and help prevent spreading the virus to others if you wash hands regularly for 20 seconds with soap and water or alcohol-based hand rub, cover your nose and mouth with a disposable tissue or flexed elbow when you cough or sneeze, avoid close contact with people, stay home and self-isolate from others in the household if you feel unwell, and most importantly, avoid touching your eyes, nose, or mouth. Welcome to Jamaica Magazine. I'm Theodore Henry. Stay with me as I take you through the pages of your favorite program.
Practice good hygiene by washing your hands frequently using soap and water. Here's how you should do it while conserving water. Turn on the tap to wet your hands, then turn off the pipe. Lather your hands and the tap with soap. Turn on the tap and wash your hands, back, front, and in between fingers. Use some of the water to wash off the tap, then turn it off. Dry your hands with disposable hand towels. If you don't have running water, use a hand rub containing 62% or more alcohol. If hand sanitizers are not available, rubbing alcohol, Dettol, white rum, or household bleach will do the trick. And if all else fails, let hand washing and the handling of potable water be a two-person event. Each person will take turns pouring and washing hands with sitting water. Now is a good time to consider installing a tap on your containers to reduce the risk of water contamination. Faucets can be easily attached to drums, buckets, or 5-gallon water bottles. And to ensure that the outside of the containers are clean when recapping, disinfect it with hand rub containing alcohol that's 62% or more. The 5 R's of water conservation are also necessary to practice. Reduce water wastage by investing in water-saving devices. Reuse water at least twice before discarding. Replace leaking pipes, faucets, and other plumbing equipment. Recycle wastewater and use it for gardening, car washing, or cleaning of public spaces. And reclaim water through rainwater harvesting. We all must play our part to ensure there's water to combat the coronavirus and stave off prolonged drought.
As we face this COVID-19 challenge, we know a number of our farmers are going through tremendous difficulty. A number of our farmers would have had contracts with our hotels and now are faced with excess produce in the field. As the ministry, we're working to treat that situation. We have tasked rather to work with our affected farmers to find new markets and to take off the excess produce. Together we can get through this crisis. A number of our farmers have reached out to us to say that they want to contribute to the government's effort. We will be utilizing the excess produce to serve areas like Bull Bay, or hospitals, or children's homes. And I want to thank the farmers that have donated their produce to this worthy cause. The ministry will continue to assess the impact of COVID-19 on our farmers, and we will look to share in the stimulus package announced by the Ministry of Finance to ensure that our farmers can get back planting as quickly as possible.
Rather, marketing officers are being the facilitator between the farmers and the supermarkets to make sure that any excess can be put into the markets. I must also say that with the cancellation in the hotel industry, there is a downturn there, but there's a good side of it. There's an upturn in the supermarkets, and so the demand has become greater. We have reassured the producers that the input suppliers have given us their word that they have in their inventory enough chemicals, fertilizer, seeds, and feed to carry us over this period. Any farmers that are willing to donate excess produce can contact the RADA office in their parishes. We have put the necessary contact numbers in the media to make sure that farmers, stakeholders can contact us and to make sure that we can assist in the distribution of the produce island-wide.
An important message from the Ministry of Health and Wellness. What to do if you think you have been exposed or are experiencing signs and symptoms of COVID-19. Immediately call 888-1-LOVE. That's 888-663-5683. In addition, you should stay at home. Don't go to work, school, or any public place. Do not use public transport, and avoid visitors to your home. You may need to do this for up to 14 days to reduce the spread of the infection. A message from the Ministry of Health and Wellness.
The National Health Fund, NHF, provides financial support to our national healthcare system in order to improve its effectiveness and the affordability for the Jamaican population. Given our increasing number of COVID-19 cases, it is best to find out how you can get proper assistance during this time for your underlying issues, which may include asthma, diabetes, and heart disease. Find out more about the NHF next.
Welcome to Get the Facts, the program that provides you with information on government's policies and initiatives. I'm your host, Enthros Campbell. Now, when you hear the name National Health Fund, you think of a card that allows certain individuals to get free medication or medication at a reduced cost. But there's more to the agency, as it also supports the development of our national healthcare system. Chief Executive Officer Everton Anderson is here to tell us about the broad operations of the NHF. Mr. Anderson, welcome to the program.
Yes, thank you for having me.
Great. Remind us of the mandate of the NHF. What was the organization established to do and how it is funded?
Right, the National Health Fund was set up some 15 years ago to provide support to healthcare in Jamaica. And at the time, it was thought that the agency would cover some key illnesses in terms of the medication aspect of care. And I think we started with 13 chronic conditions in terms of coverage, and it really provides support to persons, Jamaicans specifically, who have those chronic conditions. We also provide support to public institutions in terms of support for capital projects, supporting health promotion programs, and just generally providing support in great areas of need in healthcare in Jamaica.
Yes, and the direct benefits to us, Jamaicans. Who benefits? How can they apply? Let us talk about that.
Right. Well, the NHF and JADEP cards are our major platforms for offering health servicing to beneficiaries. For the NHF card, once you're diagnosed with any of the chronic illnesses listed, and we now cover 17 conditions, I think we recently added 2, sickle cell in 2015 and lupus a few months ago. Once you're diagnosed with any of those conditions, we have our application form. Your doctor verifies you have the condition. You then come into any one of our offices and you get your card within 15 to 30 minutes. Initially, the benefit was mainly offered through our Kingston office, but we have listened to our stakeholders and we now have access to the NHF card on a same-day basis in every single parish in Jamaica. For the JADEP card, it's a card for persons 60 years and above. So once you get to 60 and you are diagnosed with any of the chronic illnesses covered, then you can also get the JADEP benefits.
All right, so the JADEP card is for 60 years, person 60 years and over, but
Yes.
the NHF is for any age.
Any Jamaican, regardless of your economic situation, regardless of your age, once you have that chronic illness, then you can qualify. Then you qualify for the NHF benefit.
Right. About how many persons do we have benefiting now from these two initiatives?
Right. Our total beneficiary count to include JADEP and NHF is about 818,000 persons who are enrolled on these programs. 818,000 Jamaicans.
Right. Can you speak specifically to the illnesses that are covered?
Right. I mentioned earlier we cover 17 illnesses.
Yes.
And this is based on the illnesses that most Jamaicans would be affected by. So it includes asthma, arthritis, diabetes, hypertension, and other chronic illnesses, lupus, We also cover breast cancer in terms of the drugs, prostate cancer, and a number of other illnesses.
Right. So in terms of the cancer, you do the drugs, but do you do some of the treatments like chemotherapy or radiotherapy?
No, we only do the drugs.
Drugs.
We actually provide a larger subsidy
Yes.
for those drugs because of the high cost of cancer care. So we provide drugs through our card programs for breast cancer and prostate cancer.
All right. Any plans to increase the number of illnesses? If so, what are some of these and how soon can we expect?
Well, we have an active discussion at the fund as to coverage. It's largely based on the funding that we have. So we go through a process of analysis every year to determine what is possible. And as you notice, in the last 3 years or 4 years, we've added 2 new illnesses. So we're always looking at new illnesses that can be covered.
Ms. Anderson, tell us a little bit more about the application process for the 2 cards. The NHF is, how is that done? Persons have to take a form to their doctors who would verify. Expand on it for me.
Right. The application process is very simple for both cards and similar. The first thing is that you have to be diagnosed as having any of the chronic illnesses. You then get your physician, your doctor, to sign on the form indicating and confirming that you have the illness. You can then get either JADEP or NHF card at any of our locations island-wide. Initially, we would offer a 7-day service at our head office, but we moved to a same-day service at head office, and we've expanded that same-day service, and it's available in every single parish in Jamaica. Okay. So if you get a diagnosis at midday, you get the form completed half an hour later and get to our office, you leave with your benefit card within 15 to 30 minutes in every single parish, because we really wanted to broaden access and really send a message that we're serious about providing an excellent service to our customers.
Tell us about the costs as it relates to both cards, the different cards.
Well, for the JADEP card, the drugs are free of cost, except that beneficiaries contribute to the dispensing fee, which is $40 per item, up to a maximum of $240. So no beneficiary will pay more than $240. For the NHF card program, we provide a subsidy. And
$240?
Maximum contribution for the
Yes.
JADEP program.
Yes.
For the NHF card, it is a different arrangement where we pay a subsidy depending on the illness. It ranges between 40 up to about 70%. We provide a greater coverage for conditions like breast cancer and prostate cancer, where the cost of those drugs tend to be a lot more. And the beneficiaries will then co-pay.
Yes.
And in some cases, they have both the NHF card and a health insurance card, which leads to a lower co-pay, which allows greater access.
Right. So I have a health insurance with a private company, and I have the NHF card.
Right.
I can use them together.
Right.
And there's no charge for getting the card.
No, the card is free of cost, and the
Yes.
process of accessing is really good. And I have to give the highest commendation to our 476 private pharmacy providers who support the
Yes.
program and have helped us to deliver what we consider to be an excellent service to the people of this country.
Okay, let's take a break now, and we continue with more on the National Health Fund. Stay with us. Welcome back to Get the Facts. We continue our discussion with the Chief Executive Officer of the National Health Fund, Everton Anderson. Mr. Anderson, the NHF is responsible for procuring and distributing pharmaceuticals, as well as managing the public sector pharmacy services. Explain, tell us how that works.
Right. Well, the process started in 2011 when NHF assumed responsibilities for what was then the Health Corporation Limited. So we've moved from that to now providing what we call end-to-end management of pharmaceuticals for the public health system. So we procure drugs through an international competitive tender, we warehouse drugs, and we also get the drugs to the hands of the patients. So it's really a massive operation that we run in that program, and we've seen our numbers move from under 1 million prescriptions annually. Last year we did 2.5 million prescriptions and dispensed over 10 million prescription items to over 500,000 Jamaicans who access care in the public health system. So it's really an awesome task that we have embraced, and I would have to, at this time, recognize the staff of the NHF who have embraced all these changes and have really performed very well despite the challenges that come with offering such a huge service.
Right. So the benefit to us would be that you know what drugs are in the system,
Yes.
and so your clients will be able to access the drugs. You know that the drugs are there, and so we can access them easier. Yes?
Yes.
All right. Yes. So you have now have a faster turnaround time of issuing the cards, but I know that you have other initiatives
Yes.
to benefit your clients. Tell us about that.
Right. I spoke about the pharmacy service earlier, and I
Yes,
just
yes.
want to speak a little about this. We have moved to really modernize pharmacy in the public health space. Our warehouse, which we inherited, is now ISO certified, and 4 of our large pharmacies are now ISO certified.
What does that mean?
It means that we've added a significant quality element to our processes to ensure that what we do is of maximum benefit to our
Congratulations.
clients.
Yes.
So we've added a pharmacy management system which enables us to move drugs around in a most efficient way. So the drugs don't belong to Cornwall Regional or KPH, it belongs to the system. So we're able from a macro perspective to look at where the drugs are and to adjust drugs based on patient needs
Yes.
at any point in time.
Yes.
In addition, we've managed to have significant reductions in waiting times through innovative initiatives like quick prescript, scheduled refill, and we are really working with our clients, bearing in mind that long waiting times can be a major barrier
yes.
to access. So I really want to say that our staff have embraced this
Yes.
service, and it really has made some strides, and we are not done. We will continue to improve.
So this complaint about persons going to the hospital and their relatives having to go outside to get medication, is that a thing of the past? Are you moving towards
Right.
improving that service?
Well, I think we have made some strides, but we have to contextualize in that the government has a list called the VEN list, vital, essential, and necessary. So at times, if a physician prescribes an item not on the VEN list, then we would not necessarily have that item. So
Yes.
persons will have to go outside. But I think we're now able to measure what we call fill rates, and we're now at between 85–88%, meaning that of every prescription that comes in, we're able to fill 88% of the
Very
time.
good.
So I think
Good.
that is very important
Yes,
to
it
note.
is. Yes. Talk to us about your drugstore pharmacies.
The drugstore pharmacies are predominantly now focused on managing a huge public sector load. As I mentioned, we have moved from about 1 million prescriptions annually to 2.5. We have some locations where we serve 400 to 600 patients per day. That is a very huge undertaking. So we really had to take a very creative, innovative approach to managing the service, bearing in mind that speed in dispensing is only one important factor. Medication safety is also important. So we have really managed to make those pharmacies a lot better, and we have plans to partner with our patients to do even more.
Yes, but people, if I have a prescription that I would take to a regular private pharmacy, if I go to the drugstore pharmacies, do I get the medication at a lower rate? at the drugstore pharmacies?
Are you speaking as a private patient?
As a private patient.
Right. Well, we predominantly, as I mentioned, are focused on the public patients. The private patients that we now see would be those cases that we define as special. For example, those items not easily available in the private sector. So we provide cancer drugs, we provide items for hemodialysis patients and other special services.
Right.
But our work predominantly is related to serving the public patients.
Okay, all right. Okay, so tell me about some of the other projects that you are working on to improve the health sector.
Right. Well, initially, the NHF started financing health projects. But for the last few years, we've moved from not only financing these projects, but to actually project management and execution. So we have done so many projects across the country. This year alone, I think it's 1.7 billion in project funding and management that we are in charge of.
Yes.
So we've done major projects.
What are some of these projects?
Elevators, new equipment. Our largest project was the construction of 2 cancer treatment centers, one in Montego Bay, one at St. Joseph's, and the value of that was about $15 million US. And we executed within time without any major cost overrun. We have an excellent project team who really understand that the needs of the public have to coincide with excellent facilities. I think for the most part, the response has been very positive. I would have looked at the core NHF benefits. The customer satisfaction has always been over 95%. For the pharmacies that would have just come on, they are about 85%. And apart from those figures, we have created avenues for patient feedback, which we use as a guide to build service excellence. So I think for the most part, it has been good, but good is never good enough in our sphere.
Yes.
So there are always plans to get better in the interest of the patients that we serve.
Great. Anything on the horizon, like soon, within the next few months or year?
Well, we have a team that says there's no 100% in what we do.
Yes.
So there are always new innovations. We have patient scheduling systems that we're working on now. Our major thing that we're doing in the next few months is a patient education and medication compliance program, recognizing that making the drugs available to clients does not mean that they will take them regularly.
Yes.
So we're actually piloting with the Pharmaceutical Society of Jamaica a program where we will manage 2,000 beneficiaries, manage them, and we actually do research to see what makes them compliant, see if we can implement that on a broader scale throughout Jamaica.
Yes. And before we go, the cards, we don't have to renew them, right?
No.
Once you get them, it's for a lifetime.
Once you get them, take care of them. But if you do lose a card, then we can give you a replacement card in the same quick speed in which you would have gotten your original card.
Okay. Mr. Anderson, thank you so very much for sharing with us on the NHF in this week's edition of Get the Facts.
My pleasure.
This has been Get the Facts with our guest, Everton Anderson, who is Chief Executive Officer of the National Health Fund. Until next time, I'm Rose Campbell. Take good care.
Tip number 1. Keep your regular medication and other supplies well stocked. Ensure there is access to several weeks of medications and supplies in case there is a need for you to stay home. Monitor food and other medical supplies needed and create a plan in the event that such resources become depleted. Tip number 2. Stay sanitized. Tip number 3. Respond to multi-generational living situations. Many older adults live in homes where other members, such as children, may have frequent colds. Therefore, do not share personal items like food, water bottles, and utensils. If possible, choose a room in your home that can be used to separate sick household members from those who are healthy. Tip number 4. Develop intentional caregiver plans. Older adults may be caregivers or may receive care themselves. Caregivers and care recipients should discuss their preparation plans, including how to stay in touch via phone or email. Determine who can provide you with care if your caregiver gets sick. And tip number 5, keep abreast of essential up-to-date information. That means you should find and regularly check a trusted information source.
The National Solid Waste Management Authority, NSWMA, wishes to advise the public that the Mandela Park in St. Andrew is closed. This is in adherence with government's restrictions on gatherings in public spaces. The halfway tree-based park will be closed until further notice. The NSWMA will continue to closely monitor the announcements of the Ministry of Health and Wellness to make decisions in the best interests of the citizens of Jamaica.
Jamaica will recover from the effects of COVID-19, but this will require a team effort, not just the government. We still have increasing COVID-19 cases, but we also have persons unaccounted for who have entered the island between March 18 and 23. You say you want to get back to your normal life, but ask yourselves this: am I doing enough to help prevent the spread of the virus or to protect myself? People, practice social distancing and proper sanitation. Stay home if you are sick. Obey the rules that the government has implemented in efforts to flatten the COVID-19 curve and keep infections low. If you are among those who returned home between March 18 and 23, please report your status to the Ministry of Health. Do your part as we continue to create a Jamaica which will be the place of choice to live, work, raise families, and do business. Thanks for watching another edition of Jamaica Magazine. Join us again tomorrow when we'll do this all over again. Send your feedback on today's show to Jamaica Magazine at jis.gov.jm. Also follow us on our social media pages and download our app on your Apple and Android devices. And you can also visit our website at jis.gov.jm for more information. On behalf of the entire production crew, I'm Theodore Henry. Thanks for watching.
This has been a production of the Jamaica Information Service, the voice of Jamaica.